Good evening, ladies. Welcome. Welcome, Darcy. Welcome, Jamie. Hello. How are we? How are
Hi.
we all? How's your week been, Darcy?
I've been pretty good. I quit my job so that I can live a stress-free free life. And I already am, so it's great.
See, this is amazing. See, you're stepping into honoring yourself and this
Yeah,
process,
yeah.
right? Sometimes it's like, these big decisions, but, saying no to something is saying yes to yourself.
Mm-hmm. I'm just like, I'm kind of journaling right now, and this is something that I did. Like, I am a whole person.
Oh, I love this. Darcy,
And
can
but
you
like,
keep it still? I love this. I love coding. I am a mum. I love astrophysics. I mean, I love cooking. You're amazing. You're amazing in the kitchen. I love playing music and guitar. I am a whole person. I love that. I am a mum. Oh, Darcy. This is the
yeah,
month of manifesting. Like, this is
yeah,
May. That's what May is
it's
all about.
coming up on Mother's Day, so I just need to treat myself.
Well done. I am so proud of you. Jamie, do you
Thank
want
you.
to unmute yourself and say hello? Do you want to say hi?
Um, Hi, I'm just really tired today, so my camera's
That's
off
all
because
right.
I'm like falling asleep. I'm going to bed
That's
after. But
well,
hello,
that's
everyone.
hello. Welcome. Welcome, beautiful. Welcome, Renata. So, ladies, I'm going to get started. And the replay is there for those that can't be with us this evening. But I'm going to just get started into the meeting. Before I do get started, I repeat myself every week, but I want you to know there's a Q&A at the end. So please stick around and you can ask me your questions directly face to face. So I don't actually look at the chat because then I get highly distracted. So what I encourage you to do is, because I'm a people person and I feed off your beautiful faces and your questions, so just ask me directly. So hang around, stay till the end. But let's get started. Let's talk. We're talking about fibroids today and the impact of fibroids on fertility. It's a big topic because if we look at uterine fibroids, I see them as one of the most common structural abnormalities of the uterus. And I see them quite a lot in my practice. All right. I see them very regularly. I think that's the biggest takeaway. And it's not surprising, as an estimated 30% of women aged between 35 and 50 suffer from fibroids. So you can see that they're very common, very common. Now, one thing I need to let you know, that uterine fibroids are not cancer. All right. And they almost never turn into cancer. I think that's the biggest fear. When women think of growths, they think, oh my God, the big C, it's scary. So they aren't linked with a higher risk of other types of cancer in the uterus either. All right. They're also called leiomyomas or myomas. We've often referred to them as benign polyps or benign tumors. Okay. So the beauty is, this is the beauty. Chinese medicine. Remember, I'm a doctor of Chinese medicine. So I'm always going to talk about Chinese medicine when I am delivering these talks. So the beauty of Chinese herbs and acupuncture is that we can reduce the size of fibroids. And I've had amazing results with fibroids using Chinese herbal medicine and using acupuncture and moxibustion. And, we can reduce the size and also some of these unpleasant side effects, which I'll get into all the signs and symptoms of fibroids as we go along during this talk. So if we look at what they grow in response to, it's excess estrogen. All right, it makes things grows the lining, so it means that we've got to find the balance between your estrogen and your progesterone. So we want to reduce your exposure to external sources of estrogen. And also we want to make sure that your liver's working well, because we need your liver, because its job is to process estrogen for you. Yes, it acts as an escort. So we want to make sure your liver's working well and that you're pooping well. So, in Chinese medicine, our poop is such a big part of this. So I often see a lot of constipation, diarrhea. There's a lot of stuff going on with the stool with fibroids. So if you haven't ever looked at the Bristol stool chart, download it. So it's amazing because it gives you an understanding. Your poop tells us a lot about you. All right, so we want to make sure that your stools are fully formed, that they're floating, not sinking, and so they're not pellety and they're not like a landslide. All right, so and then that there's not undigested food in the stool. All right, so download the Bristol stool chart, have a look. There's 6 categories. Are you sitting at normal, which is a number 3? All right, so we want to look at your poop. It correlates a lot when I'm talking about fibroids. And I know it's a bit of an uncomfortable topic, but Chinese medicine, we talk a lot about your poop. All right, so in Chinese medicine, fibroids are related to blood stagnation. Qi and blood stagnation, but it's the blood stagnation. Because if you look at it, what a fibroid is, it's like a congealed blood clot, right? Okay, makes sense, doesn't it? So it just means that there's a lot of issues with circulation, particularly in that pelvic area. All right, so we're going to look at strategies to help move qi and blood stagnation. And often there's an emotional component to this. All right, so we've often got to explore that. Where are you feeling blocked in your life? It's like the changes. Even Darcy talking about leaving her job, making these changes. Moving. If you're not unhappy in your work, then maybe we need to explore alternatives in that workplace. So we'll address that later on in the talk as well. Now, if we look at fibroids, they vary. They vary in number and size. All right, so they can range from a pea all the way up to an orange or a grapefruit or a football. Yeah, amazing, right? And there can be many of them. There can be one of them. And there's the variance is just, it's like human beings, we're all so unique. All right, so if these growths are, sometimes they can be really small, you can't even see them with your eyes, but they can get very big and they can really distort the abdomen and the uterus. So they can distort the shape of the uterus, they can make it difficult for implantation, and they can really fill that stomach area, so they can make a person actually look pregnant. I remember one of my lecturers, she told us an amazing story of her having fibroids, and it was the size of a football, and it was extraordinary. I've never forgotten that. When I first started practicing Chinese medicine, one of my favorite lecturers, Sue Roger Withers, she's an amazing practitioner, but she had this fibroid and she talked all about it, and she related it all back to the Chinese medicine, the qi and blood stagnation, and it's just stuck in my mind. So I've always had this thing with fibroids. I've always wanted to work with them, and I was inspired by her. All right, so many people who have uterine fibroids, they sometimes might not even know about it, right? Because a lot of the time they can be asymptomatic. So you may have no symptoms. All right. So the main complaint that I tend to find when, I'm working with fibroids, because often you don't know you've got them. Usually it's spotting. You might have spotting before the period. You might have heavy menstrual periods. You might be struggling to get pregnant. All right. So, or you might have painful periods. So these are just kind of some of the markers that I'll start to go, right, could it be fibroids? Or, sometimes I'm thinking fibroids, endo, there's my little fertility detective mind starts thinking how to treat you as soon as I hear you complaining about those things. All right. So, with the larger fibroids, often, there's pain with intercourse. There can be pelvic pressure, pelvic pain. And if the fibroids are on the back wall of the uterus, all right, now that can lead to the constipation. And then often there's urinary tract stuff, lots of leakage, lots of, urinary tract infections even. So if we're looking at the effects on pregnancy, all right, so the most common complication of fibroids during pregnancy is pain. All right, it's seen most often in women that have fibroids larger than 5 centimeters in diameter. And that's when you're getting into the last 2 trimesters. All right, you may see fetal growth restriction. There can be sometimes placental abruption. This is where your placenta completely breaks away from the uterine wall because it's blocked by the fibroid, and it reduces oxygen and nutrients to the baby. So Then there can be preterm delivery. Often, if they're undetected, normally we're detecting them before you're pregnant, but, often, women that do have these fibroids that are around that 5 centimetre mark, they'll often need a cesarean section, C-section. Often there'll be breach because, that normal shape of the cavity the baby might not be able to align for the vaginal delivery. And then often, I tend to find there's a lot of miscarriages with fibroids because they can reduce the blood flow to the placenta and they compete for the space for the developing baby. So it makes sense. But like I say, normally they're treated beforehand. Normally you'll know about them before. All right, especially if you're working with a practitioner, and usually we tend to find all of this stuff out in your preconception care. But if we're treating them before pregnancy, so often, if we look at conventional medicine, because I really do like working integratively, sometimes we need to, because if we've got things that are large, as a general consensus, if they're greater than 3 centimeters and they're causing heavy bleeding and pain and all this kind of stuff, we tend to use a myomectomy. So this is a surgical procedure and it's used to remove the fibroid. All right, and then it will decrease your need for a cesarean. But the thing is, with a myomectomy, you are going to have to wait around 3 months following the procedure before you can start trying again. So you're going to have 3 months and then do your preconception care again for your 3 months. So it is a bit of a wait, but sometimes we need to address those things, because if it means that we avoid, miscarriage and a difficult delivery, then it's worth it. So you've got to weigh these things up. Now, conventional medicine, clearly they're going to look at, balancing the hormones, and they'll often put you on the pill, the IUD, what else? The gonadotropin releasing hormone agonists. Now, all of these medications, they block the production of hormones. And so you're not ovulating and menstruating. So, this is not a solution if you are wanting to get pregnant, clearly, right? But women that they're bleeding and they've got painful periods, often this is the solution when you go to your conventional doctor. Myolysis is another strategy. It uses an electric current, laser, or cold liquid nitrogen or radio frequency. Myolysis can cause scarring. So you need to be aware of that. So it's not as invasive as a myomectomy, and it's certainly not as invasive as a hysterectomy, because that's the end result. Clearly, we won't be doing that if we're trying to get pregnant, but that's the end thing that they would recommend in conventional medicine. So pretty much, if you've got something smaller than 3 centimeters, we can usually fix them. Greater than 4. Clearly, if they're larger than 10 centimeters, they will need to be removed. Okay, so let's look at the signs and symptoms. All right, so often, like I said, heavy or prolonged bleeding, we call that menorrhagia. You could have painful periods, which we call dysmenorrhea. Bleeding between periods. Now, this can be just in between. It can be around ovulation. It can also, usually I'll see it before, the spotting before the period. Okay, there's ongoing tiredness. If you've got this heavy bleeding, clearly, and long-term heavy bleeding, you're going to have anemia. All right, so you're going to feel tired. There's going to be a lot of weakness. All right, and I find that these women, they've got low red blood cell count. They're anemic, and so when we do the bloods, we start that. The investigations usually start with that for me, with your bloods. There can be abdominal discomfort or bloating. Like I had one lady, she was quite stressed, but her stomach was just growing like out of control, and she had severe bloating, pain during sex, feeling really full, lots of pelvic pressure. You might have, like I said, constipation, or even like every time you do your poop, it could be painful defecation. It's not pleasant, and it can fluctuate. So you can get a lot of IBS. So it can be constipated, then it's diarrhea. So we've got that alternating. All right, you might have difficulty emptying the bladder. All right, so bladder issues, leaking. What else? You may have had recurrent miscarriages. You may have had, just difficulty getting pregnant. And then like I said, it can interfere with implantation of the fertilized egg in a number of ways. So the egg may sometimes it tries to actually implant on the fibroid itself. Interesting. And it changes the shape. So, we can get, it's distorted. So often, sometimes we can confuse it with adenomyosis because it can appear like the uterus is bulky. But this is where we need an MRI. We need to have the right scans. So normally we'll start with an ultrasound, but really to confirm it, you really do need to put an MRI on it, especially when we're trying to differentiate between fibroids and adenomyosis. Okay, because we want to make sure we give you the right treatment protocol. So like I said, the general consensus is less than 3 centimeters in diameter, and it's not causing any problems. Generally, we can work on it with the Chinese medicine. There's protocols that I'm going to go through with you, and they can just clear up. All right, but it's about treating the environment. The environment's super, super, super important. But if they're large, then clearly, and you're not fixing the environment, they're not going to go away. And often if you're not fixing the environment, you might get them removed and they come straight back. All right. So anyway, let's talk about how Chinese medicine views it, the lens through which I look at it. All right. So in Chinese medicine, principally, we see that they're related to the liver and the spleen. All right, so there's a lot of stagnation of qi and blood. Phlegm retention plays a major role in the pathogenesis of abdominal masses. But I usually see it's 3 basic patterns. All right, so like I've said, blood stagnation, qi and blood stagnation. That's number 1. So this is just that lack of smooth blood flow to the pelvis. And often that's related to, so the second thing is, spleen qi deficiencies. And this comes from your diet, improper diet. And it means that your digestion, it comes back to that microbiome and it builds that turbid phlegm, that dampness. And then we've got the attack by or the retention of pathogenic factors. So it could be cold, you could have damp, you could have heat or toxins, all right? So that's just how my mind thinks when I'm treating fibroids. Part of the strategy in Chinese medicine, this is what I love about Chinese medicine, because not one person with fibroid, it gets the same treatment. I have to differentiate. Is it coming from improper diet? Is it coming from cold? Is it coming from that retention of those pathogenic factors? Or is it just that energy that's stuck, that blood stagnation, that qi and blood stagnation? So we've got, I'm going to keep it basic, but in Chinese medicine, we've got 2 formulas that I might use for fibroids. Wager Fulling one. All right, this formula is it's famous. It's well known for its effectiveness in treating fibroids. It targets blood stagnation. So it's often used for fibroids, and it's got ingredients like wager, which is your cinnamon twig. So that's one thing that I get my patients to look for and to see. Can you taste the wager? All right. Then we've got peach kernels, taoren. All right. Bai shao, that peony, white peony root. And then I might, if there's severe pelvic pain and we've got lots of clotting in your period, I might add in something like sanleng. All right, it reduces that blood stagnation, it invigorates the blood, and it dissolves accumulations. That's what I love about sanleng. If you've got, things like cramps and cramping and pain, so xiangfu, chenpi, yanhu suo, these are herbs that I would use for that. Chenpi is your mandarin peel. So even if you're using food, I even get my patients to keep all the peels, whether it's grapefruits, lemon, zest, orange peel, tangerine peel, put them on some baking paper in the sun, dry them out, and then you can actually use them in your cooking. So you can even use them as zest if they're fresh. Okay, so it dissolves accumulations. Da Huang if there's constipation. Now, the second formula I'll use is Shao Fu Jiutang. This formula is another popular formula that we will use for treating fibroids in Chinese medicine. It's especially when the fibroids are associated with that lower abdominal pain, and there's lots of clots in the menstrual blood, and there's a lot of internal cold. So xiaoqi shuang, that's fennel seeds, all right, ganjang, which is dried ginger. This is in the formula. We've got the dangui, we all know that, the Chinese angelica, and these are just some of the herbs in that formula. All right, so you know, you can see that Chinese medicine is amazing for breaking this stuff up. All right. Some supplements I might use, because I work very integratively, so I might use vitamin D. So studies suggest that low levels of vitamin D are linked to the increased risk of fibroids, and then it helps with the mood too. So you want to I usually supplement with vitamin D with nearly every patient that's trying to conceive anyway. So yeah, vitamin D is up there. It's at the top of the food chain. Curcumin, it's the active component in turmeric. It's anti-inflammatory. It's got antioxidant properties that help manage the symptoms associated with fibroids, and it inhibits the fibroid growth by affecting the fibroid cell directly. All right, your omega-3s, they're important. They're found in your fish oils and your flax seeds. All right, they help reduce inflammation, and they may aid in the reduction of the pain associated with fibroids. Now, Vitex is something, it's a consideration. It might help balance the hormones if I'm seeing that that's where the balance is. It's, you know, balances progesterone. It can be beneficial in managing fibroids. Its effectiveness varies. So you need to be prescribed this. Don't just, oh, I've got fibroids, I'm going to take Vitex. No, it doesn't work like that. Everything that I do has a purpose. So that's why your diagnosis is everything in Chinese medicine. Diindolylmethyl, it's the DIM. This is in your cruciferous vegetables. So I will often use food before I'll supplement DIM. Okay, because DIM can actually then reduce your estrogen too much. So I would rather you do your cruciferous vegetables like your broccoli, your cabbage, your kale, your Brussels sprouts, your bok choy, yeah, all those things. DIM helps balance your estrogen levels. Now, if it's severe, so if I do the Dutch testing and you know your estrogen's off the chart, then I may prescribe DIM. I'll often start with calcium deglucarate. I like this supplement. I love this because it helps you detoxify excess hormones. It's one of my go-tos, RN Labs. I love calcium deglucarate, and it works by supporting the process of glucuronidation in the liver. Okay, amazing. It's one of my favorite supplements. Then we've got maca, Peruvian ginseng. It's an adaptogen. It can lower estradiol and promote progesterone. You can try this 1 tablespoon per day in your food. Caution, it doesn't work for everybody, all right? So you just want to stop if it makes your symptoms worse. Now, what are some of the other strategies? Let's jump into that, because you're at home. This is where you can actually jump in and you can take care of yourself if you have fibroids. So we want to look at how much estrogen you're taking in, because this environment we live in, there's so many chemical estrogens that are entering our food and water supply. So, you know, we've got agricultural chemicals, we've got pesticides, and they mimic the activity of estrogen, and they provoke heightened estrogen receptivity on the estrogen receptor sites. Okay, so, you know, we've got urine that gets contaminated in the water. So there's residual estrogen from birth control pills that seeps back into the water supplies. You know, we've got plastic wraps that are leaching estrogen-like compounds into our food. So obviously, you know, trying to put a plate on your food instead of plastic over everything. Okay, let's try and get off birth control and, you know, these things, because that's going to just raise the estrogen levels. All right, so other things we can do. We want to be aware of excess fat, because, you know, if excess fat can increase the amount of estrogen in your system. Now, that just means also losing a little bit of weight or looking at your fat content. We want a balance of your macros, protein, carbs, and fats. But if you're having too much fat, are you eating all the fat off off your fatty foods? So trim the fat. It could be lowering the fat, having higher fiber, and lots of your vegetarian style, you know, veggies. All right, I'm not saying a vegetarian diet, but it's, you know, looking at the plate and just seeing, is there a colorful plate? We want to make sure that your meat and your dairy, you know, I tend to get everybody off dairy. Try and go organic where possible. We want to avoid refined hydrogenated oils. And then, as I've said, eating all your cruciferous vegetable because it works on the DIM. So we want, scientific research shows that the diindolylmethane, this is what I love, it works on supporting the good estrogens. And that's the 2-hydroxyestrogen. While it reduces the bad estrogen, that's the 16-hydroxyestrogen. You can see this in the Dutch testing. That's what I love about Dutch testing. So I actually offer Dutch testing. If you don't know that, then this is something, it gives us a really big snapshot of what you're doing with the estrogen in the body. So other things, bitter greens, they help flush out metabolized estrogens. They're found in radishes. They're found in your dandelion tea. They're found in artichokes. So you want to have about 1 serving a day. Other things, sprouts, they're full of sulforaphane, high in diindolylmethane. So, those broccoli sprouts, they're amazing. So you could have 2 to 3 tablespoons of that a day. I have them as a snack on some rice cakes or corn cakes with some avocado, sprinkle your flax seeds, all right, because, those seeds. So we look at phytoestrogens. So phytoestrogens, they come from plants. These are your flax seeds. Now, they bond to the receptor sites and they stop the uptake of the more harmful xenoestrogens. They come from chemicals. So when you're doing your plant-based phytoestrogens, that's why I often will get all my patients into seed rotation, whether you have estrogen dominance anyway, all right, because we want the hormones balanced. So seed rotation, basically, let me explain quickly, from day 1 of your menstrual cycle until mid-cycle, so until you ovulate, so roughly day 1 to 14, but not everyone is, we don't all have 28-day cycles, but for the purposes of mentioning seed rotation, we will do from day 1 to day 14. We have 1 tablespoon of your flax seeds and pumpkin seeds. And then from after ovulation, we move over to your sunflower seeds and your sesame seeds. So it's 1 tablespoon of those. Ground them down. All right, you can put them into your oatmeal. You can actually just eat them, swallow them, however you get them in. Seed rotation, it's a good practice that we can do. And, just buy those bags. Sometimes I have my patients that are lazy and they just want to do them all together. And I've got a recipe that we can actually make some little crisps and roll them into a baking tray. And if anyone wants that recipe, let me know, and on the replay, and I can add that recipe. So soy products, this is where it's a bit of a controversial issue. So soy itself, soy milk, it's just too much phytoestrogens, all right? So you can have the soy products, so products of soy, so edamame, tofu, tempeh, right? But soy milk, no. I have had so many patients that just get into the soy milk and their skin breaks out because it messes up their hormones. It really throws the balance out. Okay, so it's going to show on your skin. It's going to just send your estrogen levels through the roof when you drink soy, because we're not designed to drink that much soy milk. All right, it's a bit like juicing. I'm not a massive fan of juicing because how many carrots can you eat? Would you sit there and eat 6 carrots? 1, 2, 3, 4, 5, 6. Well, you try eating 6 carrots because that's how much you might juice. So I would prefer you to eat the carrots and get the fiber so it works on that peristalsis action of your bowels than juicing. All right, so juicing's not so much, we're not so much into that in Chinese medicine because it's very cold, it's very raw, and it's hard to digest in a fertility, protocol. All right, so we want a warm womb. So juicing might be, if it's summer, maybe, but not all the time. Okay, so I'm not anti-juicing, but it's not, I don't want you to wake up and have cold green juices first thing in the morning. It's the worst thing you can do for your stomach and spleen in Chinese medicine when we're trying to make good quality embryos. Okay, so we want to support the liver. All right, this is the liver's job. It's to break down estrogen. So it has a harder time if it's not detoxifying properly. And it's got to do this day in, day out. All right, so what do? Anyone that's worked with me, we'd start with our morning ritual. What's in the morning ritual? Well, it's 6 ounces. It's roughly about 250 mils of water. And we add in 2 tablespoons of apple cider vinegar and a squeeze of fresh lemon. Sometimes I'll add a pinch of cayenne pepper to open up the blood vessels. All right, especially if you're too hot, clearly no. But if you've got a lot of internal cold, cayenne pepper's awesome for opening up the blood vessels and great for that chi and blood stagnation. All right, then we want to stimulate the liver with all things green, because the liver loves green. That's the color of the liver in Chinese medicine. So anything green, dandelion greens, endives, arugula, spinach, clearly all things that are slightly sauteed, cooked, kale. Kale should always be sauteed, never eaten raw in Chinese medicine. We want to saute everything. We want to cook everything slightly warm. We want to change the thermic nature, right? The thermic nature of food, and you change it by cooking. So lightly steaming, sauteing, baking, right? All of these things are important when we're trying to make good quality embryos. We want to support your liver with certain herbs like dandelion root, milk thistle, artichokes, turmeric, and then B vitamins. All right, they help with the liver. So they're found in whole foods like lentils, like blackstrap molasses. They're in your supplements. In particular, it's the vitamin B6, which enhances the breakdown and removal of estrogen in your body. And then we want to move the blood in the pelvic area. So how often do I talk about castor oil packs in my life? Nearly every single time. So we want to apply castor oil packs. When we're trying to conceive, we only do them from the last day of your period, okay, when you stop bleeding, until ovulation, then stop. If you are bleeding, I've got a patient at the moment, she's bleeding and it's extended the bleeding. So it increases blood flow. So if you are finding that your periods, if you're doing castor oil packs while you're bleeding, it's going to increase the bleeding. So that's why we don't do it when you're menstruating. So that's when they're contraindicated. Unless there's a lot of stagnation, if you've got really stuck chewing blood and day one it's not moving, I might get you to do a castor oil pack. But then once you're in flow, we stop the packs, okay? And we resume the packs after you finish your period, and then we stop after ovulation. All right, so it helps with the lymphatic, it helps move debris. All right, so I've removed 4 fibroids just from using castor oil packs. All right, and if you want to make a castor oil pack yourself at home, use a piece of flannel. So I usually get a jar and make yourself a flannel, square piece of flannel, and cover it with castor oil. That one piece of flannel, put it in your jar, because you can put it in the refrigerator each time you're not using it. You might want to do your castor oil packs every day or every second day, especially if you're in that follicular phase. And that one pack will last you 30 times. Amazing. 30 times. It's pretty awesome. Yeah. So it's the cheapest investment into your fertility and your fibroid health is castor oil packs. All right. So, that pack is going to invigorate the blood. It's going to be soothing. So you'll cover it with some, either a beeswax wrap, try and avoid the plastic. Then we put a heating pack on the top, whether it's a wheat bag or a hot water bottle. And then you can drink Chinese tea, or you can have your dandelion tea. Yep. All right. We want regular exercise. We want movement. Time on feet, I call it. And with all my fertility coaching patients, we do swing ups, moving the chi in the horse riding stance. And then you can do the pendulum, going side to sides, letting the arms swing against the body like this. It's great on the spine, great on the legs, prepares you for, labor, because you need strong legs to go through labor. All right, we need the strength. All right, so the swing arms, it's great for movement. It sends the chi and blood down to the palace. All right, so we need moderate exercise. It's not exhausting exercise. So everything's moderate when we're working in fertility. All right, so warm baths, Epsom salts, all of these help improve circulation. You might want to even add in some of your essential oils. I love essential oils. So some frankincense, some lavender, some geranium, these things. Acupuncture, I've mentioned this, it promotes blood flow. So, if you've got pain and you've got serious issues going on with your periods, try some acupuncture. It's amazing, because with heavy periods, acupuncture can actually stop the blood flow. We use points down on the toes, liver 1, spleen 1. They're great for stopping that really heavy bleeding. All right, but we've also got moxibustion, which is going to help break up some of these masses. Now, one thing I want to mention, our bodies need rest. They need nourishment, especially when you've got fibroids, all right, because our bodies need time to repair, to rejuvenate. And guess where we get that from? Sleep. I can't stress the importance of sleep when you have fibroids. All right, it's super, super important. And I think we underestimate the power and simplicity of this, of repair and rejuvenation and sleep. All right. And we just need, hydration, the simple things, sunlight. All right, getting that sun exposure on your face. And it can be just 10 minutes of sunlight, direct sun exposure in the morning, going for an early morning walk. All right. These are the building blocks of feeling our best and the ways our bodies heal, the ways our bodies cope and keep us moving. So our mental health, our hormones and organs, they rely on this foundation of rest and rejuvenation and sleep. All right. So then I just want to wrap up with the emotional side of things. I don't know if you've heard of Dr. Christine Northrup. She's the author of Women's Bodies, Women's Wisdom. One of the first books I read when I was studying Chinese medicine, and I just love her. She's awesome. Have a look at her. Have a listen to her on Google and YouTube. But she says that fibroids, they represent creativity that was never birthed. All right. So she talks about dead-end jobs. She talks about dead-end relationships and conflicts about reproduction and motherhood. So we need to explore these conversations, the emotional side of what's going on with your fibroid, because it's not always just a structural thing. There's the emotional component. There's so many layers to this. So this is a big red flag, all right, because we don't often talk about our emotions enough. And, how are you feeling today? Like, how are you really? We need to learn to open up. So lastly, just a few things that you can do. In addition, learn to meditate, download some of the apps. And even if you do like walking meditations, it could be even washing the dishes, where you're ironing. That's a meditation where you're just completely beyond time and space, ironing clothes. It doesn't always have to be sitting and being like the Buddha, all right? Meditation has a lot of different applications. Breathing exercises are powerful. I teach them with all of my coaching clients because it turns on that parasympathetic nervous system. All the pranayama techniques I teach, 4-7-8 breathing, lower diaphragmatic breathing. All right. So it's all that belly breathing where you learn to breathe like a baby. All right. It turns on your parasympathetic nervous system. Qigong, Tai Chi. You might want to take up yoga and Pilates. All of these things that teach you how to breathe and connect to your body. You might want to even hire a life coach, a health coach, or a fertility coach like me that can help you explore the ways in which you are blocked. All right. And this is the biggest takeaway. Learn to say no. Because when you say no, you're saying yes to yourself. All right. So as we've explored today, an integrative approach is often the best way to deal with fibroids. And you can see that, we can manage this with Chinese medicine and integrative medicine. And there are promising pathways to reducing fibroids and actually putting you on the path to better health and to motherhood. So thank you. Thank you all for joining me. Thank you for your time. Thank you for listening. If there are any questions, I'm going to open up the forum for the Q&A.
To ask you a couple questions, it's Jamie.
Yeah, Jamie, go for
I'm like, this should be a kind of a basic question, but I'm not sure. I'm a little confused. My doctor told me that I have polyps. Is that the same thing as a fibroid?
it. Yeah, indeed.
What is it? Okay. This was like, are they the same thing? Are they something similar? Or the same
It's
thing?
just like, yeah, it's a mass.
Okay.
Yeah, it's congealed. Benign.
Also, sorry. And just something you were saying about the soy. I stopped drinking soy on purpose too about the estrogen, but I went recently into putting the soy creamer in my decaf coffee. Does that matter?
Yes, let it go.
Okay.
Throw it away.
Okay.
Put it in the bin, please, Jamie.
I'll use almond milk stuff then. That's okay, right?
Okay, yeah. Yeah, try coconut. Try a blend of coconut and almond. Beautiful.
Coconut one. So I'll stick with almond.
Yeah, and froth it up. If you can froth it up, you don't need the creamer.
Yeah, I guess. Yeah. I know, because it has the sugar. That's why I was trying to get one with
Right.
less sugar.
That's right. You've got it.
another quick question. I wasn't sure because I keep getting emails from your system. When I did that first call with your husband, the fertility call, sorry, my computer's not working properly. Is
Okay,
that the free call, or can I still talk to you personally
talk to me
before
on
I
these
start the
live
program?
Q&As. You can talk to me on these
Pardon?
live Q&As.
Okay.
Where are you? Are you in
Okay.
my school group? Are you in my school group?
Yes.
Yeah,
I
if you're
don't
in my
use
school
that app
group,
that well.
you can just DM me, darling. Yeah, you can ask me any
Okay.
questions in a private DM. Absolutely.
Okay. I'll do so then.
Any more questions, Jamie?
So I don't know. It's like breaking up when I talk to you, but it was fine
Oh, okay.
before.
Okay, that's all right. Well, if you want to direct your questions to me in school, that's yeah, or you can put them in the Q&A thread. You know, I love it when you put your questions in the school Q&A thread because everyone learns from your questions, Jamie. So feel free to ask
Okay.
me as many questions as you like.
Okay, great. Thanks so much.
You're welcome. You're welcome, darling.
Hi, Dr. Fiona. It's Renata. I'm driving back
Oh,
from Dr. Linda.
oh, beautiful. How was acupuncture?
Oh, it was lovely. She did cupping. Um, I
Beautiful.
I'm I was kind of almost like beating myself up and like, why do I still have liver cheese stagnation? So,
You're so hard on
um,
yourself, Ron. You're so hard on yourself. You know, energy just
oh,
gets stuck. It's just we all deal with liver chi stagnation. I would say most women, and this is like, I would say 99.9% of women have liver chi stagnation at some point during the day. It's just about how do we move it? How do we get back into the flow?
yeah, that's right. And I think, yeah, during the day, I'm noticing a lot because I'm in my head. I love being in my head because I'm problem solving, I'm thinking of solutions and so on, but then I forget that I have a body and I need to take care of that. And then I look in my mirror, I'm like, my tongue, it looks red. Oh
Yeah.
no.
Do you know
um,
what the beautiful part of it, Renata, is that you're learning about tongue diagnosis. So in Chinese medicine, for those of you that are listening and that aren't aware that in Chinese medicine, we look at the tongue as a diagnostic tool. So it correlates to all the areas of the organ system and the meridian system that we work with in Chinese medicine. So, you know, we're looking for areas, the color, we're looking at the texture, we're looking at the shape. And so Renata is learning all about tongue diagnosis, and she is now becoming a tongue expert because she can look at the tongue and go, oh, I have liver cheese stagnation, which is reflected by little dots that look like a strawberry, little red dots, and that's the cheese stuck. All right. And so for those of you that are listening, you might want to look at your tongue. Is it looking pale? Is it looking red? Are there spots on the tongue? And see, this is a diagnostic tool that we use in Chinese medicine to differentiate your pathogenesis. So thank you for sharing that, Renata. You're learning so much. I'm very
yeah,
proud of you.
oh, thanks. I am. On the fibroids, last question here.
Yeah.
So I have two, okay, like I messaged you earlier. Two fibroids are on the outside. One is what the doctor said, kind of in the border, but not in the uterine cavity.
Yeah.
As far as um, hold on. As far as miscarriage goes, I just arrived home. So as far as miscarriage goes and breech births, um, is that any is there any risk in that because of the fibroid location, with mine being so far on the outside?
Yeah. Do you know what the size of it is exactly?
I think they're all under 3 centimeters right now, I
Yeah.
think.
Yeah. Yeah. It shouldn't be a problem. That's, there's always a risk. It's always good to know going into it that there can be that risk. The great thing is that, doing your regular acupuncture, it prepares you. And also all the work that you are doing, we're always working on that liver detoxification. And we are getting your detoxification pathways working more efficiently. You can see the improvement even in your BBT in the last month. Like, look at the shift. Look at the shift. we've had in 1 month.
Mm-hmm. Right.
Yeah.
Right.
So the process
Yeah.
works. If you follow the
Yeah.
process, it's rinse
Mhm.
and repeat. Yeah.
Yeah. I'll be interested. I can't put this anywhere, but I'll be interested in having those. Yeah, if my formulas do reduce the fibers, because when I had the HSG, I do have
Yeah.
an ovary higher than the other ones.
Yep.
So my heart
Yeah.
uterus is kind of like this, and the
Yeah,
doctor
right.
thinks
Okay.
that it's because of the fibroid, but I don't know.
Yep.
I hope that it's not the structure won't mess this up.
Yeah. Look, I had a lady, she had fibroids and she had a heart-shaped uterus, and her baby grew in one side of it. Like, this, it's bicornuate uterus. It's like the heart-shaped uterus. Anyway, it's all possible, darling. It's all possible.
Okay.
She followed this
Okay.
process. We've reduced it. She was able to birth naturally. She birthed naturally.
Wonderful. Okay. Cool.
You're welcome.
Awesome. Thank you.
All right, Ines, are there any questions from you? No? Okay. I want to thank you all for, hold on, maybe, Ines, yes?
No questions. Thank you.
Okay, you're welcome. All right, so ladies, thank you for joining me. So we are covering these topics each week. If there's anything that you would like me to speak about and that you'd like to know more about, so I will see you this time next week. Thank you again. Thank you for your time. Thank you for listening. Lots of love. Sweet good night.